If you live in the modern world, you definitely know what stress is. We have all been in these situations. Traffic jams on the way to work, a sudden deadline, a loud alarm clock in the morning, a line at the clinic, calls, notifications. Sometimes it feels like we are living in a state of constant pressure. But here is an important point that is often overlooked. Stress itself is not harmful. Stress is a normal, natural reaction of the body. Without it, we would not be able to wake up in the morning, make quick decisions, or cope with unexpected situations. What is dangerous is prolonged chronic stress, the kind that lasts for weeks, months, sometimes years. The kind that does not allow the body to return to recovery mode. The kind that accumulates and literally restructures the functioning of the brain, hormones, immunity, and all body systems. A scientific review showed that prolonged stress disrupts normal cortisol regulation and has toxic effects on nearly all body systems. And today I want to talk about 10 symptoms of chronic stress that are easy to confuse with separate diseases. And because of this, many people spend years treating the consequences without eliminating the cause. Symptom 1. Digestive problems. Our gut is a vast nervous system, saturated with millions of neurons and immune cells. Therefore, when stress becomes constant, the digestive system reacts very strongly. People begin to experience alternating diarrhea and constipation, bloating and abdominal pain, nausea, symptoms similar to irritable bowel syndrome. Sometimes it even feels like an ulcer or Crohn's disease. The symptoms can be that pronounced. It is important to understand, stress itself does not cause peptic ulcer disease, but it can significantly worsen the course of an existing ulcer and affect treatment effectiveness. This is confirmed by a large study showing that stress increases inflammation and slows mucosal healing. In addition, a 2015 observational study showed that high levels of psychological stress increase the risk of developing peptic ulcer disease even in people without Helicobacter pylori infection and without the use of non-steroidal anti-inflammatory drugs. That means stress is an independent risk factor. As for gastroesophageal reflux disease, acid reflux from the stomach into the esophagus, today there is convincing evidence that stress intensifies reflux symptoms. Burning sensation, pain, discomfort. This occurs due to increased esophageal sensitivity, heightened anxiety, tension, and subjective discomfort. However, direct evidence that stress systematically reduces esophageal sphincter tone or increases acid aggression is limited. Thus, stress is not the main cause of either ulcers or reflux, but it plays a huge role in how severe these conditions are, how intense the symptoms become, and how well a person responds to treatment. These symptoms often persist for months, and people begin undergoing gastroscopies, tests, searching for a disease, while the root cause is chronic nervous system tension. Symptom 2. Changes in the brain and cognitive impairment. Yes, stress can change brain structure, as indicated in this study. A 2014 article showed that chronic stress leads to atrophy of certain brain regions and a reduction in overall brain weight. And Reznikov et al., in their 2007 paper, reported that stress hormones cause long-term structural changes in neurons with lasting consequences for the nervous system. So what do we see in practice? Problems with concentration, attention deficits, memory impairment, difficulty making decisions, a feeling of brain fog. Many people describe it like this. It feels like my brain is not loading at 100%. Stress literally interferes with thinking. Symptom 3. Mood changes. Along with changes in the brain, mood disturbances appear. And here there are two mechanisms. Stress disrupts the balance of neurotransmitters, serotonin, dopamine, norepinephrine. And it also disrupts the gut microbiota, while microorganisms are directly connected to the brain via the gut microbiome brain axis. As a result, the following appear: reduced ability to feel pleasure, anxiety, tearfulness, low baseline mood, irritability, loss of sense of humor, anger outbursts, aggression without clear reason. And a person thinks, I've become unbearable, while the problem is physiological. Symptom 4. Sleep disturbances and chronic fatigue. These are among the most common signs of chronic stress. Studies show that stress makes it harder to fall asleep, disrupts sleep depth, and causes nighttime awakenings. A person may sleep 7 to 8 hours, but wake up feeling as if they did not rest at all. A person notices that physical activity has become more difficult, shortness of breath appears, fatigue, reduced strength, without an objective reason. Some people even develop chronic fatigue syndrome, which persists despite prolonged rest and lasts almost continuously for several months. Scientists noted that, for example, prolonged stress associated with economic problems can increase the risk of developing chronic fatigue up to 5-fold and work-related pressure up to 7-fold. Memory is also often impaired, not only short-term but also working memory. A person forgets words, names, what they intended to do. Symptom 5. Cardiovascular disturbances. The action of stress hormones such as cortisol, adrenaline, and norepinephrine leads primarily to sustained, not temporary, increases in blood pressure caused by vasoconstriction. Therefore, hypertension is caused not only by poor diet, low physical activity, or excess body weight, but also by chronic stress. A 2017 publication clearly demonstrated that psychosocial stress more than doubles the risk of developing hypertension. In addition, people living under constant stress often experience an increased resting heart rate exceeding 80-90 beats per minute. Of course, circulatory disturbances can lead to further health problems. For example, studies conducted in 52 countries showed that people experiencing chronic work-related stress have a 2-fold higher risk of heart attack. Another study notes that prolonged exposure to multiple stress factors increases the risk of heart attack 3-fold. Scientists point out that chronic stress also contributes to the development of coronary heart disease. I quote, "Chronic stress increases the risk of developing coronary artery disease and an unfavorable cardiovascular prognosis, and acute emotional stress can trigger acute episodes of coronary artery disease. This is due to the fact that chronic stress increases the level of pro-inflammatory molecules in the body, which, among other effects, damage blood vessels and led to this disease. In addition, stress is also a factor contributing to stroke development. One scientific study states that chronic stress increases the risk of stroke by as much as 59%. Symptom 6. Decreased immunity. Perhaps the most obvious but often ignored sign. Stress weakens our immune system, making us more susceptible to viral and bacterial infections. Moreover, a comprehensive scientific review covering 27 studies showed that people experiencing prolonged psychological stress are at higher risk of upper respiratory tract infections. Stress also reactivates viruses. For example, the herpes virus, which is present in our bodies. This has long been proven. And one more interesting fact. While stress is active, you may not get sick at all. But when stress levels drop, immunity crashes, and you suddenly catch a cold. Symptom 7. Muscle tension and pain. If you often experience headaches, migraines, lower back pain, neck stiffness, a sensation of a lump in the throat, or jaw clenching, these can also be manifestations of chronic stress due to constant muscle tension. Over time, even premature wrinkles appear due to persistent facial muscle spasms. Twitching of the eyelids, lips, and hands is characteristic. This is related to overactivation of the sympathetic nervous system and electrolyte imbalance. Symptom 8. Vision and hearing disturbances. This symptom surprises many people, but stress affects the sensory organs. First, prolonged stress causes tension in the eye muscles and pupil dilation, which can lead to blurred, unfocused vision and difficulty concentrating on specific objects. In addition, chronic stress and associated cortisol cause dysregulation of the sympathetic nervous system, which also contributes to visual disturbances. Certain vascular reactions are triggered, impairing microcirculation in the eye, leading, for example, to hypoxia and potentially increased intraocular pressure. It sounds like an ophthalmologic problem, but it is often pure stress. Second, studies show that prolonged exposure to stress may contribute to hearing problems, as chronic stress can cause direct damage to the cochlea, part of the inner ear. Symptom 9. Decreased libido and reproductive dysfunction. Chronic stress also has a significant impact on sexual dysfunction and the reproductive system. This applies to both women and men. In women, stress hormones can cause menstrual cycle disturbances and reduced libido. The article provides evidence linking stress to disruptions of certain reproductive hormones and ovulation disorders. Men also experience changes: reduced testosterone, decreased libido, erectile dysfunction, impaired sperm quality. In men, observations under stress conditions showed reduced sperm concentration, total motility, and percentage of rapidly motile sperm. This directly demonstrates deterioration of sperm quality during psychological stress. And this is not a psychological cause, as is often said. This is pure stress physiology. Symptom 10. Behavioral changes. With prolonged stress, new behaviors appear: avoiding people, calls, messages, provoking conflicts, abusing stimulants, impulsive spending, overeating, or conversely, barely eating, biting nails, losing concentration and discipline, or excessively overloading oneself with workouts. At first glance, these are just new habits. In reality, they are the result of constant nervous system overload. So chronic stress is not just fatigue or tension. It is a condition that gradually changes the functioning of the brain, immune system, heart, digestion, hormonal system, and even our microbiome. And often we treat symptoms that are actually just reflections of an overloaded nervous system. Manage stress before it starts managing you. Thank you for being with me. See you in the next videos.